Good news for those of you that have been vaccinated against coronavirus. Dr. Fauci says you no longer need to wear a mask outdoors. So let's talk about this and more in the coronavirus pandemic. We're joined now by Dr. Brittani James, co-founder of the Institute for Antiracism in Medicine and assistant professor of clinical family medicine at the University of Illinois College of Medicine. So, doctor, good news for those that are vaccinated. Wondering when you think we'll be able to be maskless everywhere. It is expected that the CDC is going to say that those are vaccinated can be maskless indoors as well soon.
Yes, I think so much of it depends on the community. When we get this vaccine uptake, as long as we continue at the great speed that we're doing, I think it'll be soon. I think we just have to be patient a little bit longer.
Doctor, I want to talk to you a little bit about that age group 12 to 15. Now we know the FDA has cleared Pfizer to give that age group the vaccine. Do you think that clears the way, or should it clear the way for schools to be in person come the fall?
Absolutely. I think we're on track for that. And, it's because we know that it does such a good job to protect all of us. And so to get that demographic, that just opens up us to have so much higher numbers. And I think it really sets the necessary stage so that we can get back in school safely.
So to that point, doctor, because a lot of folks are talking about how many adults need to be vaccinated before we can all be maskless indoors. I've heard numbers like 70%, 80%, which seems to be around the number of herd immunity. Is there a number, do you think, of students, of children that would need to be vaccinated in order to make going back to school something that is safe?
I think that's one way to think about it, is hitting a certain number. But, there's so much nuance, and we have to understand that regional rates of vaccination are different. For example, we know in California, we see the vaccination effort being so strong and just recently announcing, a 1% rate. So I think I really try to more think of it region by region and look how those regions are doing to make those local calls. And I think some areas are just doing better than others, and we have to pay attention to that.
On this topic of children being vaccinated, I've been doing a lot of reading up. It's because I have kids in that age range as well. And there is some talk out there, some chatter that people don't want to get their kids vaccinated because they're afraid that it might cause infertility. Is there anything to that? Have you heard this? And what is the science telling us?
Absolutely. And actually, we hear this about more than just this vaccine. These sorts of beliefs are rampant on lots of vaccines. There's just no evidence. A lot of people talk about primary ovarian failure. We just have no evidence that that is a cause, and it's just not a medical concern that we in the professional community think about. It's just not something that the evidence shows.
So then, are you seeing some of this vaccine hesitancy, not just in parents not wanting to vaccinate their children, but among adults themselves? It feels as if we're getting to that point right now where a lot of the folks who wanted to get vaccinated have now been vaccinated, at least with one of those shots, if not both of them. So how do we combat that vaccine hesitancy going forward, at least for adults, if not also the children?
I think one thing that people should hold dear is that when we look at places like California that have had such successful vaccination campaigns and efforts, we are seeing a return to normalcy. We are seeing hospitalization rates drop, death rates drop. And the big takeaway is that these vaccines are working to restore the normalcy that we're all so desperate to get back to. So I definitely understand the remaining hesitance. I think what's good is that we see supply now coming back up, and so access becomes less of an issue, at least for most people. We, of course, still have underserved areas that are still struggling in this area, but that hesitancy piece, I encourage people to look around and understand that in the areas that have really embraced vaccination efforts, we are seeing a return to normalcy at a speed that's higher than places that are a little more hesitant, and that's something to consider.
I, of course, have to ask about what's happening in Ohio, which is where if you get vaccinated, you can be entered into a lottery to win $1 million. At first, I thought, I wish that was happening here in New York. I might go and throw my name in the ring to get $1 million. But what do you make of efforts that states are making around that? You know, that they'll put money down for your student loans if you are a college student, or if you're an adult, that they'll give you as much as $1 million, or at least the chance to win $1 million to go out and get vaccinated. Should more states be employing efforts like that to get more folks to get the vaccine?
You know, we can kind of say, what sort of world are we living in? That's on one hand, but on another hand, I have to smile for my home state, actually, of Ohio, for really thinking outside of the box about what will incentivize people to get this vaccine. I think, you know, that sort of approach, we have to understand that not getting our community vaccinated, not hitting our goals, keeping things closed hurts our economy. And so that is certainly a financial reason to kind of think outside of the box. So I actually commend my home state of Ohio for thinking outside the box about encouraging people to get vaccinations. So I think it's great, and I hope more states think outside the box in that way about what it's going to take to get their populations not only access, but feeling comfortable and having their question answered, and yes, even financial incentives to get it done.
Yeah, you know, we had the West Virginia governor, Jim Justice, on recently to talk about how he was giving out $100 bonds to treasury bonds to folks to get vaccinated. But the lottery, the $1 million, I think trumps that.
That's a new one, isn't it?
Finally, what do you think about, the horrible situation we're seeing in India right now, and what can be done to alleviate the situation there? I know a number of corporations, U.S. corporations, are banding together to try to get supplies to India as they are crushed by this second wave.
I think that's so important. And I hope that what people are realizing is that we are a global community. Viruses don't care about borders. And so, you know, our fates are tied together as humans. And I think it's really important that we extend, if we have more resources, that we think on a global stage, and that we're good global partners, and that we help other countries who just lack the same access. And quite frankly, our fate is tied to them. And I think that's what people need to understand, is that when other states or other countries, are not able to control the virus in their borders, we see more variants, and it really just puts us all at risk. But really, the argument is a humanitarian one. We're all humans on this planet, and we have a responsibility to our global neighbors to support them.
All right, we're going to leave that there. And I should mention the CDC has now made that announcement about being maskless indoors if you are vaccinated. Dr. Brittani James, Assistant Professor of Clinical Family Medicine at the University of Illinois College of Medicine, thank you so much for being with us today.